Organizing Chairperson Dr. Sylvia Matthew, Organizing Secretary Dr. Swaroop Hegde, resource persons, panelists, faculty, postgraduate students, I wish you all a very good morning. It is indeed a privilege and honor for me to deliver the report of the Association of Conservative Dentistry and Endodontics of Karnataka for the period of April 1st, 2021 to March 31st, 2021 as the Honorary Secretary. I would like to express my gratitude to all the office bearers of the Executive Committee and life members who have extended their support and cooperation and contributed to the development of the association. The Executive Committee meeting was held on 29th October 2020 and 5th of January 2021. A meeting of the heads of the department of the Dental College in Karnataka and Executive Committee members of Yes Karnataka was held on 21st of January 2021. The programs and activities conducted by the association, we have a total active members, 115 student members and life members of 106. The programs and activities, the first program, which includes the Restorative Update Lecture Series, which was conducted at A.B. Shetty Memorial Institute of Dental Sciences, Nitte, deemed to be University, on 24th November 2020 by Dr. Neelam Mittal, Banaras Hindu University, Varanasi, on vital pulp therapy, and Dr. Sai Kalyan, Director Research and Academics, Previous Research Laboratory. We delivered a lecture on dental biomaterials. Cons Endo Day celebration, 5th March 2021. The reports have come from 5 institutions. The first, A.B. Shetty Memorial Institute of Dental Sciences, Mangalore. A month-long celebration programs were conducted under the aegis of Professor Dr. Mitra N. Hegde, Vice Principal, A.B. Shetty Memorial Institute of Dental Sciences and Secretary, ACE Karnataka. Dayanand Sagar College of Dental Sciences, Bangalore, under the able guidance of Professor Dr. Rupa Nade, Dean, Professor and Head of the Department, President, ACE Karnataka, sensitize the students about the scope of this specialty in dental practice and to teach them the current concepts of minimal invasive dentistry. Faculty of Dental Sciences, Ramaiah University of Applied Science, Bangalore. Various activities were conducted throughout the month of March 2021 under the able leadership of Dr. Srinivas Murthy and Dr. Swaroop. KVG Dental College, Hospital Sulia, under the able guidance of Professor Dr. Krishna Prasad, various programs were conducted to celebrate the National Cons Endo Day. Oxford Dental College, Bangalore, did Endo Magnum 2021 under the able guidance of Dr. Sri Rekha. IACD National, the 4 upcoming events, 6th and 8th, we have already started the rapid recap Sculpt the Future, which is kick-started by this inaugural function. The next program is on 22nd to 23rd April 2021, the basic rapid recap, which would be at MCOTS Mangalore, and that also would be an online program. And then we have the IACD National Conference at Belgavi, which would be in November 2021. And the most important is the ACE Karnataka Awards. The release of the new issue of official publication is one which has taken a back seat, and we will definitely look forward for it also. The future plans are the contact directory of the ACE Karnataka life members and ACE Karnataka Journal Club once in a month for involving all the postgraduates of the state. I would like to take this opportunity to congratulate Dr. Srinivas Murthy, Dr. Swaroop, and Dr. Sylvia from Ramaiah Dental College for the excellent arrangements done for the success of the Rapid Recap 2021. Dr. Sri Rekha and Dr. Ramya Raghu for all the efforts in coordination of the scientific programs meticulously. I would also like to place a record of this on that this program was outlined and planned by the President of ACE Karnataka, Dr. Rupa Nade, and thank her for a dynamic leadership of this association, which would benefit so many postgraduate students during this time of crisis. On behalf of the IACD ACE Karnataka, I would like to thank her for her inputs and the leadership. I would also like to appreciate the efforts and of the coordination of Dr. Purnima, the Master of Ceremony. And any association requires a balanced leadership, documentation, and thanks to my Joint Secretary, Dr. Vandana Sadanand, and my Treasurer, Dr. Aditya, for managing all the work efficiently and quietly. Now, the next part of, after my report is the next part, which is the most important, that is the ACE Karnataka Awards 2021. It is indeed my pleasure to announce the ACE Karnataka Awards 2021. The first award, that is a Lifetime Achievement Award, goes to Dr. Shashikala K. from RV Dental College. Congratulations, Madam. Distinguished Researcher Award, Dr. Shruti Nagaraja from Ramaya Dental College. Congratulations, Dr. Shruti. Academic Excellence Award goes to Dr. Moksha Naik, Principal and Dean, KVG Dental College. Congratulations, Dr. Moksha. Clinical Excellence Award goes to Dr. Adarsh MS from VS Dental College. Congratulations, Dr. Adarsh. Young Achievers Award postgraduate category goes to Dr. Shazina Kaiser from A.B. Shetty Memorial Institute of Dental Sciences. Congratulations, Shazina. Young Achiever Award undergraduate category goes to Mr. Sudeep Narayan. Congratulations, Sudeep. Looking forward to the steadfast efforts and unwavering support of all the members, let the insight of the founder members lead to the acceleration of the growth of the association. Wishing all the postgraduate students a successful interactive revision to excel in exams and all the best for the exams and for your professional lives. Thank you. Signing off, Mitra Hegde, Secretary, ACE Karnataka.
Thank you, ma'am. My heartiest congratulations to all the award winners. It is now my privilege to invite Dr. Rupa Nadig ma'am, Dean, Professor and Head at Dayanand Sagar Institute of Dental Sciences and President of ACE Karnataka to deliver the presidential address. Over to you, ma'am.
Thank you. A very good morning to one and all. Dignity present, the fellows, unity and body conduct.
Excuse me, Rupa ma'am. Sorry
for you this morning.
Excuse me, Rupa ma'am. Your audio is not clear. There is a connectivity lag.
As the founding president of ACE Karnataka, sense of responsibility coupled with a fervent desire to serve and nurture the vision and mission of this association in Karnataka. The primordial aim of this association is
I'm sorry, we seem to be having some connectivity issues. Please bear with us.
She has to log out and log in. I think, Rupa, you need to log out and log in. We can.
Yes, Rupa has logged out. Kindly excuse us for this lag and network issues. Our technical support team is looking into it. In the meantime, we will move forward towards the vote of thanks. In this regard, I invite our beloved Professor and Head of Faculty of Dental Sciences, RUAS, and Organizing Secretary of Rapid Recap 2021, Dr. Swaroop Hegde, to deliver the vote of thanks.
Should we wait for Madam to tell the presidential address, or?
Yes, she will come in
let
before.
Her come. After that, I'll give a vote of thanks. Yeah.
Correct. Just 2 minutes. I think. Correct.
Yes, correct.
I think it's a very good response. I think I can add on a few sentences until Rupa comes in. I think it is the idea of rapid recap started about a year ago. And in the second year, I think we will be very happy to know that we have about 180 registrations, not only from the state, but also from all over the country. And we have not advertised or put it in any groups. But I think it is an achievement from Team Ramaya and ACE Karnataka that there was such a good response, even though it was in a very short period of time. That shows how well the scientific coordinators have planned that program. And with a scientific head like Sri Rekha and Ramya, we can always expect it to become better and better every year. I think students would be waiting for programs like this to happen in Karnataka.
So Menon is coming for Canada. First of all, happy with that.
So I think Dr. Rupa has joined the meeting and she will continue. Only thing this year that we did not make it compulsory that all the participants did not become members of ACE Karnataka. But I would welcome every student who wants to become a member of ACE Karnataka, which is going to be a vibrant association, can always become life members even after you pass off. You want to continue your association with the Karnataka Association of Conservative Dentistry and Endodontics, an invitation to all faculty and the students, you can continue being members of our association so that you would be getting the link to all the programs that we conduct. Welcome back, Dr. Rupa Nadik. So I think she will continue.
Yeah, is my audio clear now?
Yes, ma'am, loud and clear.
Is my audio clear now?
Yes, ma'am, loud and clear. Welcome back.
Very good morning to everyone. Sorry for the interruption. Dignitaries present here, fellow members of fraternity and the budding conservative dentists and endodontists. I'm here before you this morning as the founding president of ACE Karnataka with a deep sense of responsibility coupled with a fervent desire to serve and nurture the vision and the mission of this association. The primordial aim of the association is to propagate scientific inquiry and continuing education by bringing all the members of our fraternity to share and gain, bind and bond, amalgamate and integrate to perpetuate the scientific knowledge for the benefit of the community at large. So advances in the field of conservative dentistry and endodontics is delicately balancing with science and technology on one side with patient-oriented service on the other. Looking back at my own surgeon over the last 30 years, I have witnessed a paradigm shift in the way we diagnose and manage cases. Improvements in the material science, especially adhesive technology, biomaterials and ceramic materials, to add to that, the advances. It's not.
Ma'am, it is audible. Please continue. Rupa ma'am, we could hear you till now. Please continue.
Rupa, you're audible. I think
Madam,
somebody asked.
continue.
I think Rupa ma'am is logging in back again.
Okay.
We'll just wait a few minutes and she will join back. In the meantime, I humbly apologize to all the participants and viewers here for the technical glitch.
Okay, what Rupa was just telling us about only the change which has occurred. She was talking about the evolution which has happened in dentistry. The dentistry which I and Rupa practiced is not the dentistry that we practice today. There is a lot of change.
Computer microphone switch on. Yeah.
I think there are a lot of speakers which are on. So adaptation to the change is what is very important, is a message what Dr. Rupa Nadik was trying to give all of us. We have changed from chalk to board to the slides to the OHP presentations to now the online classes talking to the computers. So this change I have seen in 3 decades of my teaching. And since we adopted to this change and we adopted to the current concepts, we are still here as leaders. So I request all the younger generation also to remember that learning, unlearning, and relearning is very important all throughout your profession to keep you updated in whatever we do. And what happens is in a postgraduate level, we learn. But during your practice and all throughout your life, it is a process of learning which continues. And if you continue to learn, continue to interact, whether it is a CDE program or a hands-on program, or if it is a workshop like this, if you listen to it, it is that which keeps you updated and keeps you up in your practice as well as in your profession. So this was the message what Dr. Rupa was trying to say, how we have shifted from silicate cement to biomimetic and bioactive materials, and we have adopted to that change. If we have to see that during my days of post-graduation, the only instrument that I have used is a reamer, and a reamer, not even a file. So we have done endodontics only with reamers and access cavity and use of reamers. If any postgraduate student has to do a RCT with a reamer these days, they would look up and say it is impossible. But we also defined success those days using reamers, and we still have follow-ups of those cases who are very happy with the treatment those days. But what is a change that we see now? We have so many irrigants, we have so many materials for biomechanical preparation, we have so many radiographic aids. We only had an IOPA which we used to check. But these days, if I look into an IOPA, I see I cannot do any diagnosis with that. But I have done my post-graduation with just looking at an IOPA. So what is the change that we see? It was a technology has improved, things have become easier, but